Hello, my name is Dr. John Alchemy, founder of RateFast, and I am here today to talk about a mini podcast on future care. Future care is something that gets brought up by many of our clients, and today I'm just going to talk a little bit about it to give you some information, maybe a little bit better understanding on what it is and how it's used. So in California, in the PR4 report, future care is a section of the form that needs to be filled out. Typically, after the injured worker has recovered, their condition is stabilized, they get their PR4 report, and the PR4 report has several elements within it. You can be referred to some of our other podcasts for exactly what those other elements are, but among them is future care. So future care is something that the evaluator and provider lays out, and the goal of the future care is to treat and alleviate the symptoms of the industrial injury. So if they're still having pain upon discharge, maybe they have a durable medical equipment need, or they're going to need to see a specialist, all those things go into the future care outline. So the most common things we see in the future care outline are going to be medications, office visits, need for physical therapy. If it's an orthopedic injury, perhaps they're going to need an injection, or maybe they're going to need a surgery or a follow-up with a specialist. Now, one of the common questions I get from the providers is, well, I don't know what to put in future care because I really don't know how they're going to do. And that's just fine. You're not really asked to create a crystal ball and say exactly what this person is going to need for the rest of their life. But in general, you want to put out broad strokes in the statement, and you want to have them medically reasonable with medical probability. So for instance, if you know they're taking ibuprofen now, you're going to go ahead and put some medications in there. Or if you know that they have a condition that can flare, like a bad knee, and if they're up on it too much, it's going to need some physical therapy, go ahead and put it in. If they're using an electrical stim unit, you're going to want to make a comment on durable medical equipment and supplies, for instance. Or let's say that they're not interested in surgery, or they were offered surgery but just don't want to do it right now. By all means, you're going to put in that they should have access to the surgeon. Another question that comes up is, well, what if they need other specialists that I'm not aware of? Maybe something comes up and they need to see a neurosurgeon, or they need to, see a neurologist. And the answer to that I tell the clients is just put down that comment as specialist care. So go ahead and put in your report that if the patient has continuing flares or symptoms not responding to the conservative treatment, they should have access to a specialist. And that's really all you need to do. Because remember, once cases are into future care, when they come back to exercise future care, they still have to have request for authorization created. It's still going to have to be approved by utilization review. So this aspect of the claim doesn't really change, and it's all going to be on a base-by-base, case-by-case situation. So do not stress over, thinking that the future care has to be, overly detailed, has to cover every aspect of your imagination. Not the case. So when you do write the future care, make it simple, make it concise, and make it appropriately broad. That has been my comments on future care. I hope this has helped. Again, you can come over to our website at rate-fast.com, check on the blog, learn all about California PR4 reports, the elements of them, and you can always reach us with any questions at info@rate-fast.com. I hope this has been helpful. Thank you.